Within the USC Community Exercise Program, I oversee and I mentor the Doctor of Physical Therapy students who are running the program. They work with each participant and help to design a program to meet their needs. We have a program for the geriatric population as well as oncology survivors. We have a community exercise class for patients with balance impairments and a program for patients with Parkinson's disease and MS or other neurologic conditions. And we hope to help people with all different needs.
So the way that I see the program is kind of a win-win for both the participants of the program as well as the students who are working with the participants. What I really try to do is encourage the students to think about the kinds of movements, activities, and exercises that would really benefit the participants, not just from a strength or flexibility perspective, but really from sort of that functional, real life, this is going to help me and I see how it's helping me kind of perspective. And then for the participants, really encouraging and motivating them to recognize that despite some kind of disability or a health condition that makes them weaker or less active, that they are capable of doing a lot, and really trying to use movement and exercise as a way to optimize how much you can do in your life.
Last night I was thinking about it. Why do I look forward to the class so much? It's because I had become very complacent and was really not working on the effects of the stroke anymore. I figured I'd leveled out, you know, and every time I come here, this is the place that first taught me you don't have to have all your improvement the first year or two. You can have a lot of improvement in subsequent years. This time I have been able to reacquaint myself with a lot of the things that helped me the most, and I am so glad that I came back.
What I learned in this community exercise class is that although we might not be able to fix or change the disease process of a patient, we can teach them and give them tools so that they can be more confident in the community and regain a lot of their functional independence that they have lost.
So our patient, she has multiple sclerosis or MS, and she's about low to moderate function. So one day she came in, she said she had a fall over the past week trying to pick something up off the floor. So we're like, okay, well, let's work on that today. You know, we're both here, we can both guard you and help practice on that. And she loved it. And she went home, she dropped something, she said she was able to use what we did in class that day and she didn't fall. That was the biggest lesson for me through that class, and I feel like it's something that I'm going to take with me into my career.
If you have it in your mind, you'll be able to walk again. So, and that's what students teach me because they're so young, their life is in front of them. And I just think it's phenomenal what they teach here.
For me, it was awesome being able to apply what we had learned in the previous, I don't know, year and a half plus, and be able to apply it to a real patient. Kind of reaffirmed, like, reminded me why I was here studying so hard.
You have a lot of input. You have 4 or 5 people that watch you when you're here. That's wonderful. That's wonderful.
It takes strength and it takes courage and it takes motivation. You can do it, you can do it. So
Anybody with balance impairments, with strength or range of motion limitations, consider joining our community exercise program so that we can create an individualized program targeted to help you with your personal goals